welcome everybody to this hearing. We call it the Senate Drug Caucus in Washington, D.C. The official title is Senate International Narcotics Control Caucus. And we particularly welcome our witnesses today because you've had to put in work like the rest of us do to get ready for this. But everybody who's here is welcome, very much welcome. Today, the Senate Drug Caucus field hearing is meant to highlight and discuss Iowa's efforts in drug control policy. I look forward to a very interesting conversation and a chance to learn about Iowa's current drug trends, our pressing issues in Iowa, and seeing how I can continue fighting for Iowans in Congress on this very important issue. Drug policy experts and scholars often note that successful drug control should be based on a three-legged stool, and that approach has three complementary legs representing prevention, treatment, and enforcement. Each leg of the stool is necessary to support the other legs. In the absence of one leg, the stool obviously is very unsteady. These three issues can and should complement each other. Sometimes one leg of the stool will demand more than the others. And of course, that's bound to happen in our dynamic and changing policy area. But a balanced and complete response is certainly something we should strive for. That's why I'm pleased today's panel is made up of experts representing each leg of the stool. I'm looking forward to hearing from each of you in your respective fields of prevention, treatment, and enforcement. Every year on my 99 counties tour, I hear from Iowans on a host of drug issues, ranging from preventing young people's use of marijuana to stopping traffickers from spreading deadly drugs. I have a few things I'd like to share and make sure that we will talk about today, since they're priorities in Congress and how they certainly impact Iowa. First, we're dealing with an unprecedented wave of fentanyl and its analogs. The Centers for Disease Control and Prevention reported that over 93,000 Americans died from drug overdose 2020. This is the highest number in a whole generation. We know overdose deaths impact rural communities at a greater rate. Fentanyl and similar synthetic drugs are the main drivers for these record-breaking increases. I'm dedicated to making sure that Congress permanently controls fentanyl analogs, and that's an issue that we've had a hard time getting a long-term solution to. We've had several short-term extensions, but hopefully the next time we deal with it, that we'll deal with it on a permanent basis. Because too many people have died from these drugs, and I think all of us would agree that enough is enough. I'm also working on bipartisan efforts to proactively schedule synthetic drugs. To skirt the law, drug dealers modify illicit substances. It seems like the dealers constantly change chemical makeup of drugs so it's legal. We can't seem to change the laws fast enough to keep ahead of them. These knockoffs are similar to controlled drugs, but because they're new and constantly changing, they aren't captured by the law. This loophole can be deadly because law enforcement can't identify the drugs. So we have to be more nimble in our approach to synthetic drugs. The issues of scheduling fentanyl analogs and synthetic drugs show the importance of enforcement. While that's critical, I also want to highlight prevention and treatment. I've long supported drug prevention programs. They help stop drug use at the outset and can save the taxpayer dollars. In fact, I worked on legislation starting the Drug-Free Communities anti-drug program, which leads efforts to mobilize communities to prevent and reduce youth of substance. Of course, there are grants connected with that, and some of that grant money finds its way to Iowa to help local and area efforts. I also helped launch Face It Together, what I referred to as FIT, F-I-T. This was the nation's first statewide anti-drug effort offering citizen strategies to combat illicit drug use in their hometowns. And Peter Komendowski is here. He's carried on that effort for me. I'm not as integrally involved with it as I was during the late 90s through about 15 years after that. Likewise, treatment is critical. Too many of us know someone who has struggled with substance use disorder. I'm grateful that Rod Courtney, who I'll introduce pretty soon, is here today to share his story and highlight his works to help families and individuals grappling with addiction. Iowans have a lot to be proud of, and many of our drug control initiatives have succeeded. But we must be tireless in keeping drugs off of our streets, preventing drug abuse, and treating addiction nationwide, and as we're concerned as Iowans, of course, in Iowa as well. Thank you again to our witnesses, everybody in the audience, for being here today, and I look forward to your testimony.